Hello, my name is Dr. Alexander Anzarut. I'm a plastic surgeon and a fellowship-trained breast surgeon. This video is entitled Breast Augmentation Surgery and is meant to provide information about risks, complications, and expected outcomes from breast augmentation surgery. The considerations that I'll be reviewing in the video include where the incision is placed, whether implants have a silicone gel or saline fill, whether the implant pocket is above or below the muscle, whether fat grafting is used, how to decide on the size of the implant, the risks and outcomes of breast augmentation surgery, the procedure itself, and finally the recovery that should be expected. There are a variety of incisions that have been used over time for breast augmentation. The most common incision is the inframammary incision, or IMF incision. It has the lowest risk of infection, it allows placement of any implant type, and allows the best control of positioning for the implant. It is shown here. Next, the transaxillary or armpit incision is used at times for placement of implants. However, this incision, as shown here, is more obvious when someone is at the beach or wearing a bathing suit. And if there is bleeding at the time of surgery, the surgeon may have to change to an IMF incision. Finally, there is the periareolar incision, or the incision around the nipple. This is used most commonly in patients who have what is called a tuberous breast deformity. Otherwise, it is avoided because of the increased risk of infection.
This slide shows a typical inframammary fold scar after placement of a silicone gel implant. The incision here is shown and hides quite well in the breast fold.
Next, we will discuss silicone-filled breast implants versus saline-filled breast implants. Both implants have a silicone shell on the outside. The silicone gel implant is shown here, and it is filled with a soft silicone gel, sometimes referred to as a gummy bear implant. Saline implants are filled with salt water or saline, shown here. Silicone gel implants are filled with a thick silicone gel and are also called gummy bear implants. Saline implants have a silicone shell and are filled with salt water or saline. They are both similar in appearance when placed. A silicone implant may require a slightly larger incision. A saline implant goes in deflated and can be placed with a slightly smaller incision. A silicone implant may provide a more natural feel. A saline implant may be slightly firmer or feel slightly less natural, although this is controversial. A silicone gel implant may have what's called a silent rupture. This is when an implant rupture goes unnoticed. A saline implant rupture will always be obvious. When the implant ruptures, it will deflate and the saline will be harmlessly absorbed by your body. Finally, there are issues of maintenance. It is recommended that in the case of a silicone gel implant, patients have an MRI every 3 years and a new implant after 10 years. This is due to implant degradation. For saline implants, no monitoring is required. The implant may still rupture, and the rate of rupture is approximately 1% per year. Choosing the implant size is an important part of the consultation process. The choice of implant size is based on the base width or diameter of your current breast. It is the most important factor in choosing the implant size. The implant width should be less than the breast base width. The bottom photo here shows measurement of the base width or base diameter. The implant chosen is usually slightly smaller or more narrow than this. The diagram above shows an implant that is too narrow on the patient's right and an implant that is too wide on the patient's left. Once the implant diameter is decided on, or the diameter range is decided on, the next decision is the implant projection. For each diameter or each base width, there will be multiple implant options. Each option will have a different projection, how far it sticks forward. The options usually range from low to low plus, moderate full, and extra full. The majority of patients seeking breast augmentation use moderate or full projection implants. Low and low plus are rarely used for an augmentation case. This photograph shows 3 implants of the same diameter with different projections. Choosing a very large implant leads to large problems. Big implants mean big problems for patients. Any implant can have displacement or shift in position. However, this is much more common for large implants. Large implants can actually tear through the skin, something known as an extrusion. With implants, there's a risk of nipple abnormality in terms of function and sensation, and this will increase greatly with very large implants. Capsular contracture, or a symptomatic thick scar forming around the implant, is more common with bigger implants. Asymmetry, especially of the upper pole of the breast, is more common with bigger implants. Large implants are more likely to lead to more skin stretching, stretch marks, and drooping of the implanted breast eventually. They're more likely to lead to problems with back pain, as well as trouble with daily living. This includes trouble with aerobics, trouble finding clothing that fits, even problems being able to fit into a life jacket. The most important factors in determining implant size include the base width or diameter of your current breast, the chosen projection that you would like. It is helpful to use before and after photos from the internet to find patients starting with similar breasts to what you currently have. Avoid focusing on the number of cc's. Consider instead projection, low, low plus, moderate, full, or extra full, when asking other people about the type of implant they have. Remember to bring photos of your ideal new breast look to your consultation. So at the end of the day, Dr. Anzarut will help you choose the right implant for you. I will provide a number of options based on your base width. In my experience, the best way to choose an implant is to place them into a sports bra and use your own hands to feel the implant with your eyes closed. Your body's ability to sense using just your hands is probably the most accurate. Avoid asking others, especially your partner or your spouse, about size decisions. This is a very personal decision, and you are the one who will live with the outcomes. The visual effect of a breast implant is more dramatic, with your clothes off, then with your clothes on, and both situations will need to be considered.
Implants can be placed above the pectoralis major muscle, as seen here. Alternatively, they can be placed underneath the pectoralis major muscle, as on the other side. This allows the muscle to camouflage the upper and central portions of the implant. When the implant is placed underneath the pectoralis muscle, there are certain advantages. There is more camouflage to reduce implant show along the upper and central chest. This is especially important among thin women. The upper breast-shaped pole is more natural. The breast stays in a more midline position when lying down. However, there are disadvantages. You cannot do heavy pectoralis major exercises because of the risk of displacement or pushing out of the implant. When you flex your pectoralis major muscle, there will be some motion of the implant. This is known as the animation effect. For this reason, implants are not placed under the muscle for bodybuilders or exotic dancers.
Placement of the implant can be done above the muscle as well. Bodybuilders and exotic dancers should have implants placed above the muscle. There are some advantages with this technique. You are able to exercise the pectoralis major muscle. There is no motion of the implant with pectoralis major muscle flexion. There is more natural breast motion when lying down or dancing. There are some disadvantages. There is a higher chance of implant show or rippling, especially along the upper and medial chest. However, this can be addressed partially with fat grafting, where fat is taken from one area of the body and placed in this region to improve camouflage. Fat grafting or fat transfer involves taking fat from one area and placing it around the implant. Typically, fat can be taken from the thighs, back, or abdomen. Fat grafting can be used as an additional procedure to help hide the implant if there is excessive implant show or rippling. This can be done for implants placed either above or below the muscle. Fat grafting can also be used to improve the cleavage or narrow the distance or space between the breasts. There are some controversies and risks surrounding breast implant surgery. Silicone breast implants have been used since the 1960s. The majority of implants have functioned well without significant issue. However, there have been defective implants. In the 1980s, Dow Corning produced a silicone implant with a defective shell, where the silicone leaked into the surrounding tissues. This led to symptomatic silicone nodules in the chest. These implants were removed from the marketplace. More recently, shaped implants were developed for patients requiring breast cancer reconstruction. To prevent the implants from rotating, a textured surface was developed. The Allergan brand macro-textured surface implants were associated with a rare cancer known as ALCL. In 2019, these implants were removed from the marketplace. To read more about ALCL, please visit the FDA webpage. The link is provided here.
Some women suffer breast implant illness. Women with this condition have symptoms thought to be caused by their breast implants. The number of symptoms associated with this are unlimited. The research supporting the existence of breast implant illness is controversial. When women with breast implant illness have their implants removed, the majority feel there is an improvement in their symptoms. For a comprehensive look at breast implant-related risks, please visit the FDA webpage on breast implants. I have provided a link here.
There are risks of breast augmentation surgery. These include risks of anesthesia, risks of bleeding known as a hematoma or a large collection of blood, risks of infection, changes to nipple sensation and nipple function, poor scarring, faulty position of the implant, where the implant is placed in the incorrect capsule or pocket, or when the implant shifts over time. The implant can leak or rupture. There can be a tight scar that forms around the implant, known as capsular contracture. Fluid can accumulate around an implant, known as a seroma. There can be wrinkling of the skin over the implant, known as rippling. There can be pain, which can be persistent after breast augmentation surgery. Finally, there is the possibility of revision surgery afterwards, or needing another surgery.
As in any operation, infection is a risk. The rate of breast implant infection is about 1%. The most common source of an infection is the skin or glands of the breast tissue itself. Infections could potentially also spread through the blood from elsewhere in the body, such as the bladder, other surgeries, or dental work. If infection of the implant is a concern, it is important to seek immediate medical attention. One of the most common complications or concerns after breast implant surgery is capsular contracture. The body will form scar tissue around any foreign material, breast implants, a splinter, a knee replacement. Scar tissue around the implant is called the capsule. It is usually thin and soft. If it becomes thick, it can be bothersome, either because of the way it looks or the way it feels. If this occurs, it is called a capsular contracture. Treatment may involve surgery to camouflage the capsule with fat grafting, removal of the capsule, placement of a new implant, or permanent removal of the implants. Additional surgeries may also be required. A third of all breast augmentation patients have another breast surgery later in life. This may be for capsular contracture, to change the implant size, adjust the position of the implant, provide a breast lift as things age, or to remove the implant. Implant rippling is a risk or side effect of breast implants. In some patients, the implant folds can be seen through the skin. This is known as rippling. Capsular contracture can also lead to increased visible rippling. It is more common if you are very thin. Placement of the implant under the muscles reduces rippling in the central and upper chest areas. Rippling can be camouflaged with fat transfer. Other aesthetic concerns can include where the top of the implant sits or rests. The smaller breast will have a higher breast fold, and this is where the bottom of the implant will sit. On this patient, it is on her left. The implant on the side of the smaller breast will sit higher, and this will lead to a higher cleavage line, as seen here on the left. This asymmetry is more obvious with bigger implants and early after the surgery. Over time, the implant will drop, and it may become less obvious, as in this patient here, where the implant height is much more similar after 3 months. It is important to realize that asymmetries that exist before breast augmentation will persist afterwards unless they are addressed with specific additional surgery. After the surgery, the implants will initially sit quite high on the chest wall, as seen in this woman 1 week after surgery. Over the first 3 to 6 months, the implants will lower or drop into a more natural position. Her implants drop significantly at 1 month, and then even more so at 3 months. A mastopexy is when the breast tissue is lifted. This can include removal of some of the lower hanging breast tissue, as well as placement of the nipple in a higher position. If there is a droop of the breast tissue and/or nipple, you may need a mastopexy or breast lift to achieve an optimal cosmetic result. This procedure may be done at the same time as a breast augmentation, before a breast augmentation, or after a breast augmentation. It is common to need a small revision of the mastopexy after 9 months, once the implant settles, especially if it is done at the same time as the implant is placed. This can be done under local anesthesia. This patient presented many years after her breast augmentation, and over time, the breast tissue began to hang lower than the breast implant itself. The lower hanging tissue was removed, and the nipple was elevated to a more aesthetic position. These are some of the things you can expect with breast augmentation surgery. It involves general anesthesia. You are put to sleep. It is a day surgery, so you will go home the same day. Pain medications are usually taken for 1 to 2 days. Most patients are able to return to sedentary work after 2 to 5 days. The use of a supportive bra with no underwire is required for 4 weeks, essentially a sports bra. Patients are allowed to shower, but there is no swimming or bathing for 3 weeks. It is important to prepare yourself for surgery to ensure that you get the best result. It is very important to stop all blood thinners. This includes medications such as anti-inflammatories like aspirin, ibuprofen, or Advil, blood thinners like Coumadin or warfarin or Plavix, as well as vitamin supplements which do increase bleeding risks. These include omega-3s, fish oils, vitamin E, and especially garlic. Try to avoid foods with garlic for at least 21 days. It is also important to reduce or stop smoking. Cigarettes contain nicotine and other chemicals that prevent healing of the tissues and increase your risk of infection and wound breakdown. Before your surgery, it is important to arrange for transportation on the day of surgery to and from the hospital, as well as an adult to stay with you for 24 hours after the surgery. If you need someone to help look after your children on the day of or a few days after surgery, it is important to get this organized as well. It is important to have your prescription medicines filled and with you prior to surgery, as well as a supportive sports bra that you can bring with you on the day of surgery. The night before surgery, at 12 midnight, have nothing to eat or drink then onwards until the day of your surgery. On the day of your surgery, you will take a shower and wash with a basic soap and water. If you are having breast augmentation through the armpit or transaxillary,
you will be asked to shave that area. Do not apply any body lotion or antiperspirants. You can brush your teeth, but do not drink any water, with the exception of a small sip of water with medications. If you're diabetic, do not take your diabetic medications. Do not take your blood pressure medications if you normally take those. Bring all your medications with you to the surgery facility, including those that Dr. Anzarut prescribed for you. After surgery, there will be some discomfort. Each individual is unique, and everybody will have a different result. The following is based on the most common outcomes. For 2 to 3 days after surgery, most patients will convert from prescription pain medicines to plain Tylenol and will start to return to sedentary activities. If your implant is under the muscle, the chest will feel tight for another 2 to 3 weeks. A supportive sports bra with no underwire is required to be worn all the time, even at night, for 6 weeks. A return to full activities may occur at 6 weeks. A small group of patients may have pain that lasts for several months. There are things that you can do during your recovery. You can eat food normally. You can drink alcoholic beverages after you are no longer taking pain medications. You can sleep on your back. You can return to light duties or office-type work after 2 days, if comfortable. You can lift your arms up to your shoulder level for the first 2 weeks, and you can lift objects that are less than 5 pounds during the first 2 weeks. Do not massage the breasts unless advised so by Dr. Anzarut.
Strenuous exercise that raises your blood pressure or causes your breast to bounce should be avoided for at least 6 weeks. This includes sexual activities. If your implants were placed below the muscle or in a submuscular or subpectoral area, avoid activity that directly involves the chest muscles, also known as the pectoralis major muscle, for 12 weeks. Such exercises include push-ups, chest press, chest flies, and yoga positions where your body weight is supported by the upper arms. The implants take 3 months to settle or lower. It is best to avoid squishing them with push-up bras that push the implants upward. Once the implants have settled, it is best to avoid long-term use of push-up bras, which can lead to upper pole deformity of the implant itself.
These photos show before and after a breast augmentation using an inframammary fold incision, subpectoral or under the muscle placement of the implant, and the use of silicone gel gummy bear implants.
To find out more about breast implant surgery, please visit my website, dranzarut.com, or call the office at 778-455-3223. Breast augmentation is not right for all patients. It's important to review the risks and benefits of breast implant surgery before making a decision. Make sure you seek out a board-certified plastic surgeon and consider seeking out a surgeon with additional fellowship training in aesthetic breast surgery.